again, it's not as simple as just giving probiotics after, which has been the kind of mode of action in the alternative community, is that, oh, you just need to make sure you take antibiotic or probiotics if you take an antibiotic. And now that's starting to happen in the conventional mainstream as well,
Yep.
where they're prescribing them. But then there's also research showing that these probiotics can actually prevent proper gut recolonization after antibiotics, and that
Yep.
also it affects people differently. As we said, there's in the research they show individual responses to these things that are like vary,
Yeah.
and so that's
Yeah.
again, this
I
is
see it in
why
the
we're
hospital all the time. I see
yeah.
them giving, there's prescriptions now for different, there's Florastor and there's Resabid, which are, one is, I think, Florastor, I think is the Saccharomyces boulardii, the yeast, I
Mm,
butchered that. And then the other one is the Lactobacillus, Resabid. Um, and they basically, they give those to patients who have, who take antibiotics and they're worried about them getting C. diff. But even taking them, they still get C. diff. The patients are
mm,
still getting C. diff. Um, so, and then the other thing to keep in mind is certain probiotics, in some, like even some of the soil forming ones, and then certain other strains, like there's some Enterobacter strains of probiotics that they have out. Some of those in immunocompromised people or older people have been associated with sepsis.
mm.
And like there's like even some of the yeast probiotics have caused fungal sepsis in immunocompromised or sick older patients. So they may have some type of symbiotic or mutualistic function in the body, but they can be a problem. So you can have overgrowth. Sepsis, I'm sure, is rare for most people. If you're walking around, normal person, I would say it's probably a very small chance you get sepsis. But there are studies of people getting sepsis with that. And I know even for my own dad, he was drinking a lot of kombucha, and it was heavy on, it had Bacillus coagulans, which is
Mm.
a soil-based probiotic, and then it had a lot of a specific yeast in there. I think it was like the Saccharomyces boulardii one, and he got like he got SIBO from it. He was drinking it every day. He was like addicted to it. He couldn't get off, and then he was started to realize, oh, I'm having a lot, like I'm burping a lot of burping, and I'm having a lot of like bloating, and I'm having diarrhea. And I'm like, do you need to stop drinking the kombucha? You need to go see your doctor and get like a breath test or something. And basically the doctor is saying that he had maybe some type of bacterial overgrowth in the intestine. And then they wanted to give him a probiotic.
Mm.
And then I was just like, why don't you try some herbal antimicrobials and, like take that for a little while and try and move your diet, your carbohydrate sources to something a little bit more easily digested, like simpler sugars, so that you're not, the simple sugars aren't going all the way down deeper in the small intestine than the starches are. And if you have an overgrowth of bacteria getting that, and over time he got fine, he cleared it, he got better. But he, for a few months there, he was really uncomfortable because he was drinking so much kombucha that he gave himself what seemed to be SIBO. So
Yeah, and it's interesting because I've seen people who respond poorly to that, and I've also seen people who actually respond really well
I
to
have as well. Yeah.
store bought kombucha and like a drastic improvement in symptoms. So again, this is why
It's
we
so
talk about
variable. It's why
yeah.
we don't want to make a recommendation.
Well, and it's why I typically don't go that route. I typically would not go towards the probiotic route because of that, and it makes so much more sense to go to allow your microbiome to restore on its own by giving the right inputs food wise and environment wise. And as
Yeah.
far as the SIBO from like lactic acid bacteria, that's not uncommon either. I mean, there's research showing that those probiotics can cause brain fog, SIBO, and like lactic
Yeah.
acidosis. So
Yeah.
yeah.
Yeah. It's important to keep that, especially because people are taking like in your yogurt. How much bacteria is in a cup of yogurt? I'm not 100% sure, but I know some people are taking like a couple 100 billion
Mm.
units, colony forming units of bacteria, and then or like trillions and high dose this and high dose that, and it's like, I mean, you could be causing an issue. Some people it helps out. Some people just clears out whatever they got going on, and that's possible as well. So
Yeah.
the other one thing I will point out is some of the the spore forming ones that are talked about in the Ray Peat community, and the ones that specifically haven't been associated with sepsis or like any type of pathogenesis. So it's like B subtilis, Bacillus subtilis. That one isn't really known to colonize the gut. It usually, from what I've seen, it will stay in the gut for about 21 days after you use it for a little while, and then it just closes out. It's because it's not the environment that it really thrives in. Um, so for short courses, I've seen reports of people clearing C. diff with that, and Clostridia the difficile, I think is the full name, but we just call it C. diff in the hospital. A really rough infection, really difficult to get over, especially if you're immunocompromised. And basically, that usually occurs when you've wiped out your normal flora with a whole bunch of antibiotics, and that one's really difficult, and that's hard to get rid of. And then the treatment for it is often harsh antibiotics, specifically vancomycin, and that really it just wrecks it worse. It just makes it, because then you get off. And since the C. diff is also a spore forming bacteria, once you clear the environment, once you start using Vanco, the C. diff will spore form, so because the environment's not good anymore, but the spores stay in the intestinal tract. And then basically what happens is, as soon as you stop the course of antibiotics, the spores regerminate and you have C. diff again. So I've seen patients just have C. diff, antibiotics, the C. diff goes away, C. diff comes back once they stop. Start antibiotics, once they stop antibiotics, C. diff comes back. And they just go like that for a period of time until eventually the body just, some people, especially very critically ill people, they don't really kick it. But for people who are healthier, I've seen older people kick it. But yeah, heard reports of people using the soil forming ones, and they've helped out, specifically the Bacillus subtilis. And that one I haven't seen any studies on it for sepsis or anything. So if anybody has them, I'd be would like to look at them. So yeah, from what I understand, there's like an anecdote about it, or an old story about it. In World War II, when the Germans were in Africa, there was like a lot of, I think, was it cholera or some type of diarrheal disease, and basically they found out that the people in the desert were eating camel dung when they had gotten an outbreak of whatever the specific agent was. I think it might have been cholera. And then they found out that it was like a bacillus species, like Bacillus subtilis, within the camel dung. And basically, the soldier, they'd like patented some process. They found some process to get the Bacillus subtilis, and they were giving it to the soldiers, and it would wipe out the cholera, because the Bacillus subtilis species itself specifically produces antibiotics in the gut, specific antibiotics. And so it can help to clear out, specifically in the colon, where most people get a lot of their issues, because it's harder to treat with the colon, because it's so much, anything you put in has to go all the way through the small intestine first and go through stomach acid and bile acids and bicarbonate and changes in pH and all this stuff, and enzymes. So they found out that those things help.